Hi everyone, I am Sanjana. I am a doctor and I work with Basic Healthcare Services, which is a not-for-profit organization based in Rajasthan in India. 8 years ago, I met a primary healthcare nurse in a remote tribal village in Rajasthan. She was providing services 24/7, conducting deliveries, immunization, available for all emergencies. She was truly inspiring, and yet her shoulders stooped, face looked weary, eyes dull. Since then, I have met many nurses like her, and a question that comes up is what makes a nurse so low in morale and confidence? To understand the life of a nurse in rural India, we need to start from the beginning. They grow up in homes where most decisions are taken by men. They're married early, are young mothers, and shoulder most of the family responsibilities. Their lives are controlled by two forces: their families, who take their decisions for them. For example, to work or not, where to go, and a health system that offers little support, such as the difficulties they face every day for building their knowledge, skills. In this environment, they have little confidence and motivation and struggle to manage their lives and work. This is the aim of my leadership project, building confidence and motivation among women nurses in rural India. For developing this, I have used a lot of my experience of providing healthcare in rural tribal communities. I have also drawn from the Albert Bandura framework, which talks of different approaches for building self-efficacy or a confidence of being able to handle any situation. But really, it is the guidance from my allies that has made the project come alive. My mentors, peers, the wonderful team at WomenLift Health, colleagues within my organization, at Indian Institute of Management, at London School of Economics, and also from the India Fellow team. I have identified a 3-point framework for building confidence and motivation of our women nurses, working with the nurse mentors, with the nurses themselves, and with their families. For the nurse mentors, I have developed a curriculum which includes topics such as principles of mentoring, building trust, and I conduct regular sessions. For the nurses, I and my team regularly work to build their knowledge and skills and to promote their physical, mental, emotional well-being. With the nurses' families, we look for ways for greater recognition and appreciation of them and create occasions for their participation. Coming to the results, I can see that the nurse mentors are more motivated, more supportive of the nurses, identify their problems quickly, and help find solutions. The nurses themselves are bolder, more expressive, helping each other more, and dealing with their challenges with strength. You can see some of the things that they have said. This is the first time we are talking about mentoring. We feel important. And we want to do this differently than how you want us to do. I'm also happy to share some stories from the ground. Vandana was working at a primary healthcare facility in a far-off village. Her husband and in-laws wanted her to quit to care for her family. She identified an ally in her husband's family who supported her cause. Vandana continues as a primary healthcare nurse, is now the coordinator for her clinic. Another nurse, Ramila, got a chance for a training in respectful maternity care in a far-off place, but her in-laws were reluctant to let her go. With support from her mentor, Ramila was able to convince her family and participate in the training. She is much motivated and is a champion for respectful maternity care. Going forward, I am going to finalize the model, measure the impact, document and publish findings from this work, and advocate for the agenda at the state and national level. I'm also going to expand the work over larger areas and then over the entire state as well. The leadership project owes a lot to my leadership journey with WomenLift Health, which has been like the lifting of a curtain. Speaking for myself, I see my strengths much more clearly now. I am able to be as I am. and I do not keep judging myself. I can see myself connecting better with people, bringing people together for a common agenda, and I'm able to see the big picture more clearly. I'm also seizing opportunities coming my way, translating them into action. Challenges don't shake me. I find solutions. And I believe that anything is possible. My colleagues' words are like music to my ears. I hear them say, I'm more confident, I'm visibly enjoying my work, connecting more with my team, and micromanaging less. Going forward, the nurse leadership agenda goes on, as does my own leadership journey. So much gratitude, WomenLift Health. You have helped me change my world. Thank you.